back, everyone. We want to talk a few minutes and draw your attention to building trust in emergencies. And while it's great if that trust can be established before the emergency happens, that's not always realistic. So how can we maximize that during an emergency? Go ahead, please. Communication is the key to helping with trust. So many things impact communication. One's primary language, the ability to hear, cognitive abilities, and whether or not someone has access perhaps to their preferred communication tools and methods. And all of those are also going to be impacted by any health conditions that may have caused the emergency. And in addition, the stress that accompanies that. Go ahead. Most people communicate with spoken words. However, that's not universal. There are lots of different ways that we communicate. And so what's the point in the aspect of communication? It's about understanding. And while there are ways to maximize that, this is a great tool that I found that is very helpful. And it's called DIVE. It's simply a strategy that you can use, but in order to use it, it's going to be helpful for you to practice this. So it stands for something. The D is the data. What is it that the person's trying to communicate? What is their intention? What are their values? What do they what's most important to them in that situation? And then what is their emotion? If you look at all those things as you are dealing with any situation, it's going to help you to better understand and going to enhance communication. Go ahead, please. So we're going to look at a couple of simulations here that we'd like to share with you. And I'd like you to think about that DIVE situation. But we have two situations. One of them is perhaps, it could use a little bit of work, while the other one, let's say, is a better example. And so we're going to spend a few minutes after this having you work together and contributing to consider what we see in these two scenarios. So if you go ahead and run those for us, we'd appreciate it.
Hello, ambulance.
Come on in. He's over here.
So what's going on today?
The little guy's not feeling well. He's been having a rough day. He's been throwing up, and he's been running a fever, but we have it down right now. And he is, he's just, his oxygen level is low. We've had him on oxygen a couple times today, but it just isn't staying up there.
So what are you looking for us to do? Give him some oxygen, give him a breathing treatment, what?
No, I can do all that here. I have all the equipment to do that. I need him to go to the hospital.
For a fever and throwing up?
He's a very unique child. He has a very unique form of epilepsy called malignant migrating partial seizures in infancy.
So he's not an infant, and I know about epilepsy.
That is true. Well, then you must not know too much about this one, because there aren't too many children in the world that have this form of epilepsy. It's very unique, and no, he isn't an infant because he's one of the lucky ones.
So what are you wanting us to do?
I want you to take him to the hospital, transport him down to the hospital, and they'll know what to do with him. They'll know how to check him out and make sure that everything's okay. With his breathing the way it is, I'm concerned that he may have aspirated, and that
he looks fine.
He may look fine to you, but you're not with him all the time. I'm his grandmother. I'm taking care of him. I'm not panicking. But I've been with this child since he was born, and I know when he's doing well, and I know when he's not.
So you can't drive him to the hospital right now?
No, I can't, because if I drive him to the hospital, I'm going to be in the front seat, he's going to be in the back, and if he throws up, nobody's going to be there to help him.
Well, you can pull over.
No, I can't pull over. There's not always a place to pull over. I need him to be cared for by the people at the hospital. I need to get him there safely and alive, and I need you to help me do that.
Well, we're not going to do anything for him.
I don't care if you don't do anything for him. One of you is in the back, one of you is driving. That's all that I need. I'll follow the ambulance. I don't need to be in there with you if that's a problem.
I mean, we can take him down. Not really.
Good, that's what I need you to do. Okay. What they do there is not your concern. Your concern right now is getting him there. And that's what I'm asking you to do. Please, just listen to me.
I mean, you got all this stuff here. It looks like you can take pretty good care of him here.
To an extent. but not as much as the care that he needs. I need him to go to the hospital.
All right. I mean, I'll go get stuff ready. We'll be right back in.
Fine, thank you.
Okay, so what did you notice? What things did you see that you feel might be better done, better, approach to the interaction? Put your comments in the chat if you would. Think about the dive mnemonic that Kelly just talked about and what we talked about earlier with communication and trust. And what did you notice and what could have been improved from both ends, from the first responders end and from the caregivers end? So let's go on to the next better process, or how we would prefer it to happen here.
Come in.
Ambulance.
Come in. Hi, he's
Hi there.
over here.
What's going on today?
Hi there, this is Isaiah, and he's having a difficult day. He isn't breathing well. His oxygen level has been low. His breathing is labored. He's been throwing up. He's had a fever, but we have it down right now.
Okay. You said his breathing's having a hard time. I'm going to listen to him real quick.
Okay.
What's Isaiah got going on here?
Isaiah has a very rare condition of epilepsy, and there aren't too many kids in the world, thank goodness, that have it. So he struggles, and breathing is one of the issues that we have. So although he may look good to somebody, he may not be feeling well at all.
Okay. He's sounding okay right now. But what I hear you saying is that he has a rare epilepsy, that one of his normal problems that he has is breathing, and that he's been having a hard time with the breathing today.
Correct. And he's been throwing up a lot.
Okay.
And I get concerned about aspirating.
Okay. So with him throwing up a lot, if you don't mind, I think we're going to shut off the food for now. I realize that he does need to get to eat, but if we can shut that down for now, that'll allow us to make sure that, there's potentially less to come out. So what's your goal for today?
Well, I'm his grandmother, and I've been watching him today, and his parents are away until tomorrow. And I think he needs to go to the hospital.
Okay.
He needs to be checked out, especially with his condition being as rare as what it is.
So I see a lot of equipment, and some of it I know, some of it I don't. So what kind of things do you guys do to take care of him?
Obviously, there's his feeding tube, and he has he gets fed through his belly. He can't swallow anything. We have the oxygen here.
Is there something I need to push to turn
Yes,
this
if
off?
you could just hit the off button.
Ah, there it is. Okay.
Okay. And
Yeah, we don't deal with that kind of stuff as much.
Oh, I understand that. That's his nebulizer, and that is for when he starts to get too clogged up. He can clear his.
Is that like a suction,
Yes.
or how does that work?
It's
okay.
a suction machine.
Okay. So, what I hear you saying, and what I just want to make sure I'm good with everything and understand what's going on, is he's been thrown up. You're concerned because it sounds like he can't quite clear everything when
Correct.
he. Okay.
That's right.
And you're concerned about taking him out of the hospital and wanting to make sure that he's breathing okay, but you're concerned about driving him down.
If I drive him down, I'm in the front seat. He's in the back seat, and there's nobody there to watch out for him. If he throws up and I'm somewhere where I can't pull the car over, it's just a dangerous situation for us. I need to have somebody back there with him.
Okay, that makes sense. Yeah, that would, we're not going to really do a whole lot for him on the way down to the hospital.
That.
We're going to get him down there. They can check him out, see what they want to do from that. But yeah, we can be back there with him, and we can make sure that we're taking good care of him, and that if he does start to vomit, we can help clear that from.
Yes, that's what I
from
need.
him.
That's the help I need.
Okay, so, and what's your plan for going down to the hospital? Are you going to follow us? Do you want to ride with him?
Whatever's best for you. If you want me to follow, I'll follow. If you want me to go with you, I can go with you. That'll be fine.
So we oftentimes recommend to folks to follow us down. That way you have a car down there. But if you think he's going to be more comfortable with you with him, that's fine. What type of equipment do we need to take with us?
I don't
to the
think we
hospital?
need to take anything. I think you have everything that we would need. If I took the hospital usually has the feeding machines as well.
Okay. So, yeah, then at that point, we're going to get set up. We've got some equipment we have to set up on a stretcher so we can hook him up and get him set properly.
Okay.
I'll be right back in, and then we'll get him out to the ambulance and go from there.
Okay, just be careful when you lift him. He recently had hip surgery. He should be good to go, but just want you to be aware that he is a very unique and fragile little guy.
Okay. Hey, Isaiah. Isaiah, I hear that you're going to take a trip with your grandma and I down to the hospital. That we're going to go down and get you checked out. Does that sound like a good plan, buddy? I promise we're not going to do anything mean or scary. We're just going to give you a drive. Okay? All right, buddy. I'll be right back in. Okay, we'll be right back in.
All right, thank you.
Okay. So before we get into some questions, I just wanted to acknowledge our first responder and caregiver. And actually, the first responder is Mark Ford. He's a paramedic firefighter in the Pittsburgh area. And that is his son and mom with his wife behind the camera. Mark is the father of 3 children. 2 have autism. And then Isaiah has a rare genetic epilepsy, who is a medically fragile patient with many other comorbidities. I misspoke. He's an EMT firefighter out in the Pittsburgh area. Mark does a lot of support in pediatric readiness out there with child seat education and other education regarding pediatrics. So thank you to Mark for helping out with that. So the question I have is, what did you notice? And again, we're going to go and allow you to put information into the chat. But what did you notice? How were the family and the first responder able to shift their communication and have a better overall interaction, engagement with an outcome that seemed less confrontational? How did this help shift that sense of trust and develop the partnership for everyone involved, including Isaiah, who, you know, can't express his appreciation or his needs, but certainly will benefit from that development of trust and partnership? And what other steps can you or have you taken to establish trust among families, their children, and first responders?